In 2026, Social Security benefits in the United States are changing in significant ways that will affect millions of Americans, bringing a mix of modest gains, rising costs, and important strategic decisions for retirees, workers, and future beneficiaries. Starting in January 2026, the Social Security Administration (SSA) is implementing a 2.8% cost of living adjustment COLA, the official figure tied to inflation, meaning the average retiree will see roughly $56 more per month in their benefit check. And about 75 million beneficiaries, including retirees, the disabled, and survivors, will receive higher monthly payments, while asterisk supplemental security income recipients will see their first 2026 increase on December 31st, 2025, because January 1st is a federal holiday. Alongside this benefit boost, the maximum Social Security payout for someone retiring at full retirement age will rise to about $4,152 per month and up to roughly $5,251 for those delaying benefits until age 70, giving higher potential lifetime income for delayed claimants. However, these gains accompany higher Medicare costs, with Part B premiums increasing to about $202.90 per month, and which will be automatically deducted from Social Security checks, potentially offsetting much of the COLA increase for many seniors, and the taxable income subject to Social Security payroll taxes. The wage-based cap climbs from $176,100 to $184,500, meaning workers and employers will pay Social Security taxes on more income in 2026. For people who continue working while collecting benefits, the earnings test limits increase to $24,480 before full retirement age and $65,160 in the year one reaches full retirement age, which affects how much you can earn before benefits are temporarily withheld. Though withheld amounts are credited once full retirement age is reached, SSI federal payment standards also rise, with individual SSI increasing to about $994 per month and couples to $1,491. And the value of work credits used to qualify for benefits increases slightly, reflecting changes in average wages. These adjustments come amid broader debates about longevity of Social Security's trust funds, the rising cost of healthcare, and ongoing calls for future reforms. And they underscore that while 2026 offers some welcome payment increases, many beneficiaries will face a complex financial landscape where healthcare costs, taxes, and claiming strategies play a pivotal role in real income outcomes. Social Security in the United States, the nation's largest social safety net and retirement program, stands at a pivotal moment as it heads into 2026, with a suite of changes that will affect millions of Americans, retirees, disabled workers, survivors, SSI recipients, and working beneficiaries alike. Combining modest benefit increases with rising healthcare costs and adjustments to tax and earnings thresholds, and against a backdrop of an 89-year legacy of providing economic security to families across the country, originally established by President Franklin D. Roosevelt with the Social Security Act of 1935 to protect workers and their families from the risks of poverty and old age and disability, and to stabilize incomes after retirement or the death of a wage earner. A program that today covers roughly 185 million workers through payroll taxes and pays monthly cash benefits to over 70 million beneficiaries through its old age, survivors, and disability insurance OASD system, financed primarily by payroll contributions on covered earnings up to an annual cap and supplemented by income tax on benefits and interest on trust fund assets. The Social Security system remains both a financial backbone for retirees and the subject of ongoing policy debate about sustainability and future reforms. As 2026 approaches, perhaps the most widely anticipated change is the annual cost of living adjustment COLA, an automatic increase tied to inflation as measured by the Consumer Price Index for urban wage earners and clerical workers, CPI, which for 2026 resulted in a 2.8% increase in Social Security benefits, confirmed by the Social Security Administration and reflected in its official 2026 COLA fact sheet. This adjustment means that Social Security beneficiaries, including retirees, survivors, and disabled workers, will see their asterisk average monthly benefits rise by about $56 compared to 2025 levels when applied to the average retired worker's benefit, helping approximately 75 million. Americans keep pace with rising price levels, even as out-of-pocket expenses continue to climb. Under these 2026 rules, Supplemental Security Income is a needs-based program administered by SSA that provides monthly payments to elderly, blind, or disabled individuals with limited income and resources, will also see its federal payment standards increase, with individual SSI rising to $994 per month, and couple SSI to $1,491 per month. Adjustments that take effect for January 2026 but may arrive early for beneficiaries. For example, SSI payments scheduled for January 1st are often issued on December 31st, 2025, when New Year's Day falls on a federal holiday. While a 2.8% COLA provides a headline boost, many retirees and analysts have noted that this increase may not keep pace with the actual cost increases faced by seniors, particularly in areas like healthcare, housing, and other big-ticket expenses, leading some beneficiaries and commentators to refer to 2026's increase as modest or slim compared with long-term needs. For lower-income retirees, especially, even modest increases can have complex effects on participation in other assistance programs. Because higher Social Security income can affect eligibility thresholds for benefits like Supplemental Nutrition Assistance Program, SNAP, and Medicaid. Crucially, Medicare premiums, especially Part B, premiums for outpatient services, are also increasing in 2026, which will be automatically deducted from many Social Security benefit checks, meaning the net increase many beneficiaries see in their bank account could be much smaller than the 2.8% headline figure. Reports indicate that the standard Medicare Part B premium will climb to approximately $202.90 monthly, with the Part B deductible rising as well. And additional income-related adjustments for higher earners could push premiums even higher, absorbing a large portion of the COLA increase for many seniors, particularly those without other retirement income, beyond benefit amounts and SSI changes. 2026 also brings important adjustments to Social Security's earnings and tax rules that will affect workers of all ages. For people who claim Social Security before reaching full retirement age and continue to work in 2026, the retirement earnings test thresholds are increasing, meaning that individuals under full retirement age in 2026 can earn up to $24,480 per year without a reduction in benefits, up from the 2025 limit. And for those reaching full retirement age during 2026, the annual earnings limit rises to $65,160. If earnings exceed these thresholds, $1 in benefits is withheld for every $2 earned over the lower limit, or $1 for every $3 earned over the higher limit. Though withheld benefits are then credited back once the beneficiary reaches full retirement age, effectively increasing future monthly checks. In addition to earnings limits, the Social Security taxable wage base, which determines the maximum amount of earnings subject to the old age, survivors, and disability insurance OSD portion of payroll taxes, is increasing in 2026 from $176,100 to $184,500. This wage cap means both employees and employers will pay Social Security taxes on earnings up to the new limit. And for self-employed individuals, the full 12.4% OSD tax applies up to this threshold as well. A change designed to reflect general wage growth in the U.S. economy and support the future solvency of the Social Security trust funds. Another technical but important detail for workers involves work credits and the value of a quarter of coverage. In 2026, the amount of earnings required to earn one Social Security work credit rises slightly, meaning workers will need $1,890 in earnings per credit instead of $1,810 to earn credit. Toward future Social Security eligibility, a typical worker needs 4 credits per year and a total of 40 credits to qualify for retirement benefits. The maximum monthly Social Security benefit payable to a worker retiring at full retirement age is also increasing for 2026, from $4,018 to approximately $4,152 per month. And for those who delay claiming benefits until age 70, the maximum possible benefit rises as well, potentially reaching over $5,250 per month, reflecting an incentive for delayed claiming that results in a higher benefit for life. It is important to situate these 2026 changes: modest increases in benefits, higher earnings thresholds, rising Medicare costs, a higher tax cap, and adjustments to work credits and maximum benefits within the broader history and financial picture of the Social Security system, originally designed to provide economic security and fight poverty among older Americans. Social Security has expanded over decades to serve disabled workers, survivors of deceased wage earners, and spouses and children of retirees, evolving into the cornerstone of retirement income for the American workforce, with monthly payouts totaling over $1.50 trillion annually and supporting tens of millions of households. At the same time, the program's trust funds face long-term challenges, with projections from trustees' reports indicating that without legislative action, the OASD trust funds could face depletion later in the decade, potentially requiring benefit adjustments or tax changes in the future. A subject of active debate among policymakers and advocates seeking solutions like adjusting payroll tax rates, changing the taxable wage base more dramatically, or modifying benefit formulas. Policy efforts such as the Social Security Fairness Act, passed in late 2024 and signed into law in early 2025, have also shaped the landscape by repealing long-standing provisions like the government pension offset and windfall elimination provision. Changes that restored Social Security benefits for many public servants who had seen their benefits reduced unfairly in past decades. This bipartisan act reflects ongoing efforts to modernize and improve the program for different categories of workers. As professionals, financial planners, retirement advocates, and consumer groups have noted, the 2026 Social Security changes require careful planning and awareness. Beneficiaries must understand not only their gross benefit increases, but how Medicare premiums, taxes, and eligibility rules, including earnings tests, affect their net income. While working, Americans need to track contributions, earnings, and work credits to optimize future benefit amounts and avoid unintended withholding. Moreover, SSI recipients and individuals with disabilities must pay attention to trial work period and substantial gainful activity thresholds, which are also adjusting upward in 2026 and influence eligibility and benefit continuation. In summary, the Social Security landscape in 2026 is a mix of asterisk, continuity and change. The foundational promise of inflation-adjusted income continues with a 2.8% COLA. SSI's safety net benefits rise. Earnings, limits, and wage caps adjust to reflect economic growth. Work credits and maximum benefits increase modestly, and Medicare premiums continue to rise and affect beneficiaries' take-home amounts, all against a backdrop of broader financial pressures and discussions about the program's long-term solvency and role in American retirement security.